Did you know that 70% of strokes start in your carotid arteries? It's something people almost never check until it's too late. But this simple test could make all the difference. If you've got a family history of stroke, heart attack, diabetes, or high cholesterol, this is something you need to pay attention to. The carotid arteries are two large blood vessels in your neck that carry blood from your heart to your brain. And over time, plaque that's floating around your blood can build up in there. The problem is you might not ever know that the plaque is forming until it causes a stroke. This is where the carotid ultrasound or CIMT scan comes in. There's two different types of tests and we'll go over them today. They're both completely non-invasive and give a clearer picture of what is going on inside of those arteries. So what is the difference between this test and a calcium score test? Now, if you've already had a calcium score test, you might be thinking, I'm good to go. But here's the thing. While the calcium score test focuses on your heart and only detects hard plaque, the carotid ultrasound can pick up on both soft and hard plaque. That's a huge difference. Soft plaque is just as dangerous, if not more, because it gets less stable and is more likely to break loose, causing a stroke or heart attack. So even if your calcium score came back low, this doesn't mean you're in the clear. The plaque could be building up in your carotids. So there is a test that you can do, which is the carotid artery ultrasound, where we can see the plaque inside of your arteries and possibly save your life. Here's 3 ways that this test can help prevent stroke or heart attack. First off, if the scan shows mild plaque buildup, your doctor could put you on medications like statins or suggest lifestyle changes to prevent the plaque from growing further. This is about catching it early before it becomes a bigger problem. Next, if the test showed moderate plaque, your doctor might want to do more testing or refer you to a specialist to make sure we're keeping that plaque in check and lowering your risk of stroke or heart attack. And if the scan reveals severe plaque, this is time to take serious action. Your doctor might even recommend surgery or other interventional methods to open up those arteries and drastically reduce your stroke risk. Now, I know that can sound a little scary, but at that point, prevention is absolutely critical. So why does this test matter? When there's plaque in your carotid arteries, it's a sign that there's probably plaque building up somewhere else in your body too, like the arteries around your heart. That can cause heart attack. So by catching it here, you're not just lowering your risk of stroke, you could also be lowering your risk of heart attack. So this can play a big part in prevention of both stroke and heart attack. The test could be life-saving, especially if you have a family history or any other risk factors like I've mentioned. Don't wait until you have symptoms, because the first sign of a stroke is having a stroke. And by then, it could be too late. Ask your doctor about getting this ultrasound or contacting imaging center that offers it. It's one of the best ways to take control over your health and prevent a stroke or heart attack before it ever happens. Now, before getting into more details on how you can schedule this test, I would like to introduce myself. I'm Bridget Hannigan, and I'm a cardiovascular sonographer. I am not a doctor. However, I am in medical imaging. And so these are the questions that I often get from patients who I'm working with. And sometimes they just don't get the answers that they need from the doctor, or perhaps they got the answer, but there was so much information happening in that appointment that they weren't able to process and remember it all. So please do not take this as medical advice and always consult a healthcare provider. This video and all of my videos are for educational purposes only. Now, moving forward to how you can get this test done, you can contact an imaging center, or you can ask your doctor to order this test for you. Now, if your doctor isn't willing to order the test and he doesn't see the reason, you can contact here at Atlanta Ultrasound, where we do not accept insurance or require a doctor's order, so you can get your appointment quickly, and it does include a cardiologist report, board certified, so that it's acceptable at any doctor or hospital office. So all of the testing and results that you'd get here would be compliant with everything that you would have in a normal medical record or hospital or imaging center. So if you'd like to reach out to us to learn for more, you can just go to www.atlantaultrasound.com and contact us, and we'd be happy to help you by answering any of your questions or scheduling an appointment for you. I hope you enjoyed everything that was in this video today. If you have any questions, please let us know. I'm at Atlanta Ultrasound. We really like to empower and educate, so just let us know if there's any way we can help. Have a great day.